Reported cases of a flesh-eating bacteria are rising in Florida and Louisiana, and it's deadly. In Louisiana, 4 people have died, and in Florida, 5 people have died from this infection. Dozens of other cases have also been reported. So let's get to CBS News correspondent Cristian Benavides live in Miami with more. Cristian, what do we know about this bacteria?
Jules, in recent years, we've seen more cases of this bacteria, Vibrio vulnificus. Now, this thrives in warm ocean water. The one that's found in the Gulf typically has the perfect temperature for this bacteria to thrive, along with the salinity. This is not found in fresh water. But recently, because we've seen these severe storms, more severe storms due to climate change, what are people doing during that time? They're wading through water. They may get a cut because there's so much debris out there. We've been seeing more cases because that's how you get it. You get it through a cut in your body, and once that comes into contact with ocean water that has the bacteria, that's how it can infect you. We're also seeing more cases in places where it hadn't been seen before. We're hearing about cases now in North Carolina, in New York, in Connecticut, because of the warmer ocean temperatures that we have over there. And it is deadly. 1 in 5 people who develop a severe infection are likely to die, according to the CDC. What's truly frightening is that this bacteria is out there. It thrives out there in ocean water, and if you have a cut, you can get it. But it only becomes a severe infection if you're immunocompromised. So let's say you have liver disease, let's say you have kidney disease or heart disease, then this is when it is likely to develop into a severe infection, where there is about a 20% chance, of dying, according to the CDC. We spoke with a man who got Vibrio vulnificus from just a small scab that he had in his leg. And he was wading through the water, fishing with his grandson, 64 years old. And it was a tiny scab. It wasn't even a cut, but the water had taken off the scab, and so the water had gotten into it. This developed so quickly. Within 24 hours, he went to the emergency room because he had developed a fever. He was having chills. And in addition to that, he started to see redness around the opening where this bacteria had gotten in, spread throughout his legs. Once he got to the hospital, doctors there told him he likely would have to have his leg amputated and that there was a chance that he could die. Mind you, this was within 24 hours that he got to the hospital. Thankfully, that did not end up happening. He survived. He survived the bacteria. But again, it is out there, it is deadly, and if you're immunocompromised, you are at risk for it.
I cannot imagine. What can we do to avoid this? I mean, yes, don't go in the water, but if you are in the water, what do you do?
Well, there are some tips that health officials have put out there in the state of Louisiana, where we're seeing a number of cases. They say stay out of brackish or salt water. If you have a wound, wash wounds and cuts thoroughly with soap and water. If skin is infected, tell doctors about the water exposure. Use caution when consuming raw or undercooked seafood. Always wash your hands with soap and water. So that's another thing that I should mention, is that you can also get Vibrio vulnificus from undercooked seafood. Particularly oysters are known carriers of this. So people may think that they've just got some sort of foodborne illness, when in reality, I mean, this could be something much more serious. So you really have to sort of monitor how you're doing, and if you feel that you've had something like such as oysters, or if you know that you had an open wound and you were out in the water and you were out in the water, you really want to mention that to medical professionals as you're seeking help for whatever it is that you get. As I mentioned, there are treatments for this, but you have to get to the hospital quickly before it develops into a more serious scenario. When I spoke to a microbiologist who has some experience with Vibrio, she told me that a person could easily die within 48 hours of exposure.
Wow. All right, Cristian Benavides, great information. Thank you so much.